Hi, my name is Sandra Ratliff. I am working with a group of fellow nurses today. We are going to be describing a community nurse, and we have chosen the role of a hospice nurse. This type of nurse has a great amount of autonomy and independence in the community. They rely completely on their skills, and they become the eyes and ears of the physician. The nurse has a great amount of autonomy. Just like I said, they take care of patients in the final phases of a terminal illness. They focus on the comfort and quality of life rather than a cure. The scope of practice for this type of nurse is the same scope of practice for any nurse or registered nurse. I want to go through these really quickly, and then we'll focus more on the hospice nurse roles. Scope of practice, like I said, for any registered nurse, just to review, is assessment, diagnosis, outcomes, identification, planning. You have implementation, coordination of care. You have the health teaching and health promotion, consultation, evaluation, ethics, education, evidence-based practice, which we, of course, integrate in all of our care, which is very important in anything we do with nursing these days. Quality of practice, communication, leadership, collaboration, professional practice, evaluation, resource utilization, and environmental health. And again, the scope of practice is very important, but again, it's important for any registered nurse. Whereas the specialty of the hospice nurse comes into play is that the skills and assessment skills of a hospice nurse have to be finely tuned and on point, because again, they're independently working out in the community. They become the eyes and ears of the physician and other entities of care. They document findings, provide physical support, and utilize other entities of care when need to be. Another crucial part of hospice nurse skills and roles is to provide pain and support management. This is important to get the patient through the end of life type care and to deal with the stages of death and dying more easily and make a smoother transition. Providing emotional support, psychosocial and spiritual, is just as well as important. And again, all these skills are important with any nursing, but it becomes more of a specialty and fine-toothing your skills to provide the specialty care. The next thing I'll be discussing is the teaching and learning strategies with this type of nursing. The main focus, I would say, that I've learned from researching this type nurse is to be aware of your own beliefs, meaning self-beliefs, of cultural beliefs, spiritual beliefs, because you do not want to enforce them on your patient, because that would cause a negative impact on that patient and its care throughout the dying process. And they're already experiencing enough stress and things to deal with through this process. They don't need to, deal with anything more negative. You want to implement end-of-life care more efficiently by assisting in developing better patient-nurse relationship. You want to be able to communicate efficiently with these type patients, or any patient for that matter, but especially with these patients, because it's a sensitive time, and for not only them, their families. So you need to know how to deal and be able to communicate with these patients and their families. You want to respect their decisions, including the family's decisions of their cultural, spiritual beliefs, whatever they decide. You need to support it, because again, it's their care, not yours. You just are there to support them and give them and assist them in anything they need. You want to increase confidence to that patient and their care, manage all stages of the pain and symptoms they are experiencing for each stage of the dying, for each stages of dying. And lastly, each patient and their family, and of course even the nurse, all have different ways of grieving, and the nurse needs to be able to identify this process, not only identify the process, but the types of grieving, the interventions that need to be implemented for this type of grieving. Things like active listening, are identifying support systems, providing emotional support, encouraging patient and their family to communicate their feelings, and even the nurse communicate their feelings, because it's important that they also do that too, to vent and deal with the process of the death and dying. And the main thing is provide individualized spiritual care and of course pain care. And that's what I had to discuss. Thank you.
Hey, my name is Ben, and I'm doing my portion of the hospice nurse project. We'll start off with hospice and palliative care nurses work in collaboration with other health providers, such as physicians, social workers, and chaplains. And these are just a few. Within the context of an interdisciplinary team, which is composed of highly qualified, specially trained professionals and their strengths together to anticipate and meet the needs of the patients and family facing terminal illness. Hospice team members may include both volunteers and paid workers who address the different needs of patients and their families. Healthcare practitioner and technical occupations and healthcare support occupations make up the largest group of hospice caregivers that interact with the hospice nurse and are responsible for medical and palliative treatment, but also provide emotional support as well, such as roles includes, and I'll go to my slides here, hospice dietitians, we have hospice aides, also called home health aides, we have medical directors, also called hospice physicians, we have licensed practical and licensed vocational nurses. We have nurse practitioners, which pretty much serve as the liaison between doctors and hospice nurse. There are multiple therapists, from occupational, physical, and speech therapists to massage and recreational therapists, all work with hospice nurses to help patients engage in everyday activities by assisting in mobility and strength exercises for rehabilitation, help maintain or improve a patient's overall social and emotional well-being. Also, depending on the patient's circumstances and stages of care, a hospice interdisciplinary team, or IDT, may provide counseling, social services, trained volunteers, respite and inpatient care, and bereavement support, in addition to the hospice nurse's role.
My name is Nicole Walters, and I am discussing educational preparation. The hospice nurse is required to have at least a minimum of a license, practical nursing license or a vocational nursing license. Once the nurse gains experience, their employer may require them to become certified. The Hospice and Palliative Care Credentialing Center offers certifications for advanced practice nurses, registered nurses, and licensed practical nurses. The advanced practice nurse must have a master's degree, and the generalist nurse must have a bachelor's degree. To be eligible for examination with any of these certifications, the nurse must have at least 500 hours of hospice practice within the past 12 months. There's also a separate certification nurses can get for pediatric hospice and palliative care nursing. Clinical experiences for the RN and the APRN provide focused exposure and competency in primary and specialty palliative nursing practice. Such education may be offered under the auspices and clinical agencies, academic institutions, and professional organizations such as the Hospice Palliative Nursing Association. Residencies and fellowships, as well as internships, all help nurses in the hospice field gain their practicum experience through interacting with peers.
My name is Wilta Sorellis, and I will be discussing what are the necessary skills and ability required for the hospice basically role. The hospice nurse or registered nurses prepare at the associate degree, bachelor, and some master degree level. The skills, they highly develop level of knowledge related to end-of-life care. They should be able to communicate with the family and the patient as well. And it requires a lot of compassion and toward the patient and with the family member in time of crisis. There is a distinctive body of knowledge with direct application to the practice of hospice and palliative care. They need to know how to assess pain and symptom management, because sometimes the patient might require they might have the pain scheduled for every 4 hours, and they come to that state where they're actively dying and they're having difficulty breathing. So you have to assess them and call the doctor for possible to change the morphine and Ativan Q2 hours or Q1 hour. And also we have the end stage disease processes, the psychosocial and spiritual. Cultural sensitivity care of patient and the family member. When you do hospice nurse, you're not only taking care of the patient, again, you're taking care of the family member because you have to support them, because it's really hard for them as well, see their loved ones going through that process. And interdisciplinary collaborative practice, loss and grieving issue, patient education and advocacy. As far as the advocacy, just like I said earlier, you have to know when to require more medicine and regard based on your assessment. And we have the ethical and legal consideration, communication skill, and awareness of the community resources. Something unique I learned about in this research is that they have a national board of certification for hospice and palliative nurses in Pennsylvania. And Pennsylvania is the only board of nursing in the U.S. that is recognized to certify hospice care nurses. And also, you can get certified. There's 2 master programs that focus on hospice and palliative care. One are located in New York City, and the other one is in Uzalin College. And also, in order to get this certification, you have to apply, you have to have a valid license, you have to send your application, and you have it take a test that have 150 questions, and you have to pass the test before you can get your certification to the Board of Nursing in Pennsylvania. That was it for the presentation. I have the reference below. We have the American Nurses Associates. We have the Hospice and Palliative Nursing Association, the Hospice and Palliative Nursing Association Standard for Clinical Education of Hospice and Palliative Nursing. So that was it. Again, that was the presentation for hospice nurse.